what happens when there's noise outside, or you're stressed, you have an exam, or you're having a great time for whatever reason. There are a lot of good reasons to lose some sleep now and again as well. But we have sleep, we've got nutrition, and we touched on that, and we'll get back into supplementation. But what are some of the other pillars of creating the proper environment for hormone optimization?
Stress is probably the next one. During both puberty, but also 20s and 30s, individuals are figuring out how they want to cope with stress and also figuring out what they want to choose to put their effort into. So if someone is overstressed, then it can put all the other lifestyle pillars, and then they stop dieting well, they stop exercising, and everything else can go askew. There is also some degree of social component to this, so perhaps they need to add a seventh pillar of social. During your 20s and 30s, you may be forming a family as well. Perhaps you have children, and the health of the family unit is going to be vitally important. Not necessarily directly for hormone optimization, but it's going to throw everything else off.
And for people that are not starting their own families in their 20s and 30s, can that social connection be extended to friendships and work relationships as well?
Absolutely. In fact, if someone's not starting a family, it is just as concerning, but for other reasons. Each individual is going to have their close group of family and friends, and if someone does not have one of those connections, that's when things can potentially get bad, not just for them individually, but also society.
So when you say stress, you mean learn to manage your stress. What does that look like? I mean, if a patient, has high blood pressure, even if they don't, you just sense that they're stressed. They have a lot of pressured speech. Or
there's some cracking and breaking up in here.
What are some of the?
Or does it always do that?
It does crack a lot.
There's different mindfulness or relaxation techniques. Going outside can often help with this as well. Dietary changes and exercise.
We got some really good cracks.
Some people like prayer or meditation.
On the last week when we were trying to
a lot of
bend it
people
back.
like counseling or therapy, or even just talking openly with a family member or a friend.
What would be some of the other pillars for hormone optimization? Here, I feel like we're not just talking about people in their 20s and 30s, but again, we're wrapping our arms around basically puberty onward. Looking back, I started meditating pretty early. I started weight training and running early. I gave some thought to my diet in high school, but really it was in college that I started thinking more about what I was ingesting and why, and trying to do better there. But people are coming to the table at different stages of life and trying to optimize for hormones. So what would be some of the additional things that everybody should do?
Everyone should get outside and find a movement pastime to last a lifetime. You're going to get sunlight, you're going to get some degree of heat and cold exposure, and you're also just going to move more. Being in an artificial environment where there's artificial lights, artificial air conditioning is going to have many effects on your body. So that's vital. Another one is finding what your purpose is in life. So I call this spirit, but it's really just the self-actualization component of Maslow's hierarchy of needs, which is basically your physical needs, your mental needs, and then your purpose in life, what you really like to do.
Picking some goal or target. And I always say that you don't have to stick to the same goal over time. Certainly I haven't.
Doing okay?
I got started early in the science game, and I'm still in it.
Just distracting myself with this as much as possible.
To pick a goal, and then once you reach that goal, to assess and then pick another goal, and so on. I think sometimes when people hear about picking a purpose, they're like, oh my goodness, I have to define, sort of like naming oneself. And you actually can change your goals and purpose over time. This is terrific. Would you suggest that people actively use or avoid supplementation prior to doing all these other things? I'm somebody that likes to throw the kitchen sink at things, but I also like to do things pretty systematically. So I always say behaviors first.
Okay, tender there.
Then supplementation, and then maybe, and if and only if there's a real need, and of course working with a doctor, prescription drugs. But there are probably people in their 20s or 30s, maybe even in their 50s, that aren't feeling great, and they want to do something in order to be able to train more or to feel more confident to seek out social connection. They're trying to go about the whole business from the other side as well. But what are your thoughts on that?
I see supplements and medications as very similar. One's prescribed and one's not. In general, medications have more side effects or potentially stronger therapeutic with more efficacy, but they are just tools to reach an end goal. So depending on the goal, if there's an individual that's an athlete, then certainly they should consider supplementation. Or if someone desires optimal or a very high level of cognitive performance, they should also consider supplementation. At the same time, food is medicine, and a lot of the benefits you can get in supplements, you can get in food as well.
Yes, it depends on how much time and energy you're willing to spend, and also finances. I know that when I was in college, I could afford just a few supplements, and they were basically whey protein and some fish oil. I was fortunate that I was pointed in the direction of those things, and some creatine. I couldn't afford much else. Over time, of course, I could afford more, but it really does often depend on finances.
Yep.
Before we get into some
And
specific
that's where it kind of
recommendations
ties in,
to
like right
optimize
here.
testosterone, estrogen, thyroid, growth hormone, etc., I'm going to ask you a
Yeah,
question
that
I've been wondering about
sucks.
for a long time.
Yeah,
So often in
that
discussion
definitely
about
hurts.
hormone optimization, people will say
Not quite as bad as the calves, but it's still super
your
tender.
libido is suffering.
Gotcha.
You might want to be concerned about testosterone or even estrogen, right? Because we know that estrogen can impact libido as well. Sometimes having estrogen too low is detrimental for libido. Or people will say you're not recovering from workouts, or you're feeling kind of depressed. The problem is it's all subjective. So how does one know whether or not their recovery from workouts, their energy, their confidence, their libido is within a healthy range? I mean, obviously for people in a relationship, they can know whether or not their libido matches the sort of cadence of the relationship and their partner. But how should people think about this and maybe even start to talk about it? Because one of the big differences, I think, between males and females is that because females have a monthly cycle, they are familiar with the changes that occur in their hormones over time, because every 28 days those hormones are changing dramatically in ways that impact their physiology and psychology. But for males, I feel like there's sort of a dearth of language to get into the more subtle aspects of this. It also has to do with privacy issues.
Every
and,
podcast I hear a term I've never heard before.
too much, not knowing what's appropriate to
Learn
share.
something new every day.
Talk to a patient.
Fucking dearth. It sounds like a dagger, like a small, like a miniature dagger.
And
If I were to
I were
to
not a psychiatrist,
go word
but
for
what are
word
your
of what I
tools
think
in
it
order
is.
to try and figure out whether or not this person could really use some help with hormone optimization, or whether or not it's something else. Or maybe they're just doing great and they don't realize it because they're placing demands on themselves that are excessive.
You want to use a lot of open-ended questions. This process is called motivational interviewing, and your
Tender
goal
there?
is to listen to the patient and
A
not
little bit, not too bad.
plant an idea in their mind that they can follow. Because everybody is going to have a different goal. Some people are better at reading their biofeedback or telling how they feel on a daily basis. There is screening questionnaires designed, for example, an ADAM questionnaire to look at men's health and hormone-related health.
It's called an ADAM questionnaire.
ADAM questionnaire.
ADAM.
Correct.
Is it available online that people could administer it to themselves? Although we don't want people
Still tender in here?
diagnoses of
It's
themselves.
definitely getting
Is
better,
it
but a
that
little
sort
bit.
of
That's
a
still
It
right
is.
there. Is
interesting.
I
Okay.
don't believe it is a clinically validated tool like an ASCVD, which is like a risk of heart attack and stroke tool, or many other tools. There's one for depression, there's one for anxiety. They're called PHQ-9 and GAD-7 respectively. But anyway, there's often in the ADAM questionnaire, and what you hear from the patient, if you are a very careful listener, is often different.
Can you give me an example of some of the questions on this ADAM questionnaire, or the sorts of motivational interviewing that you might do? So say I'm your patient, we sit down, what sorts of questions would you ask to probe these kinds of dimensions of hormones?
Questions about libido, questions about athletic performance, questions about motivation, and often the patient will answer one thing, but what you hear from them subjectively is far different.
Interesting. Can you give me an example of a question? I'm happy to be the guinea pig here.
Lots of
Classic
fibrosis in
one
there.
is A guy
Yeah.
comes in, and a lot of times they say, "Oh no, the wife made me go to the doctor." I go once a year. That's it. I don't want anything. I don't want any medications. Their screening questionnaires might be zeros across the board, so nothing, no issues.
Feels like
They're
it's
perfect
softening, though.
health. They talk to you for
It's
a
getting
while,
less pain. I mean, it's
some
still
rapport,
painful,
like
but
you,
it's definitely
and right as
becoming
you're
less
finishing the
painful.
visit and about to go out the room, they mention that their libido isn't quite there, and they're having a little bit of ED as well, and perhaps are even having some chest pressure tightness.
I see. So right as you're leaving the room, a patient will tell you that they're having some sexual side effects, or not side effects.
Definitely some nerves tied up in it because
And then
it's still
you mentioned
tingling my
chest
feet.
pressure.
Yeah.
Is the chest pressure a sort of general decoy for it's got to be my heart, or is it related
Well,
to
the
the
tissue
other
is so
parts of the
hard
It can be related. In
that
fact,
if the nerve's
erectile
trying to
dysfunction is
pass
the
through it,
canary in the coal
partially
mine.
it's getting
So
compressed
coal
by
miners
that
would take the
hard
canary
tissue.
down, the
Because
canary
usually
died,
nerve, like
coal miners
when I
would
put pressure on it with the
recover
blade,
from
the nerve moves out of the way.
And often,
or it just
one of
compresses.
the causes of
Gotcha.
PG is plaque
But if
buildup,
that
which
tissue
happens
surrounding
as
it,
well.
like if it's
But
really
sometimes they
deep,
notice the symptom
deeply
in
just
the genitals.
concreted in all this area.
So for such a patient, let's say that patient was a young person where plaque buildup in the arteries and veins is not.
See,
all
now it's not so
likely for,
concrete.
Let's say in their 20s or 30s.
It's a little
What
deeper
would
in
be
there
your
though.
next step of the interview at that point, and what would you consider? Would you immediately order labs for that person to try and rule out any kind of actual hormone level deficiency?
I certainly would order labs. There are some individuals that are very similar and they come in and they have the same symptoms, and one individual might have a very, very high testosterone, and one individual might be severely hypogonadal. So there's a big difference between the subjective and what the labs look like. So I
Tender
certainly
here?
order labs.
It is tender,
You
yeah.
also ask them about if it's situational or not. You ask them if they have ED, if they're, you ask them about their habits. You can ask about porn and masturbation and all these issues. And of course, that's between the doctor and the patient. And depending on what they tell you, you can often determine if there is a situational component. Some people call it psychogenic ED, but I don't love the term psychogenic ED because it kind of puts some blame on the patient's mind. But
Very
a lot of the
tentative.
time that is the case. There's even a test,
Roger that.
and this is very rarely ordered, but it's called a nocturnal penile tumescence.
Yeah, because is it true that there are periodic erections during sleep? Correct.
Yes.
Yeah.
So you basically put a cup to see if you're having a normal sized erection during sleep. And I believe about 90% of the time they do that test, they are indeed having erections.
Which would point to this psychogenic origin of whatever challenges they're having in terms of sexual interactions. You mentioned porn and masturbation. This topic has come up a bunch of times on this podcast and on other podcasts I've gone on because of the relationship between dopamine, sexual motivation, and sexual behavior. And I've been of the pretty strong stance that while I'm not judging porn or masturbation, it can create a brain wiring situation where males in particular essentially teach their brain to be aroused by watching other people have sex as opposed to being the first person actor in sexual interactions. So in that sense, that's more about the brain wiring and neuroplasticity and dopamine, but what are your thoughts on porn and masturbation as they relate to hormones? I mean, this is a big debate on the internet. In fact, one of the most common debates is whether or not masturbation increases or decreases testosterone in males. Certainly, it will decrease motivation to go find.
You have to cut out the
sexual
podcast
partners.
and the video.
And there are more and more data on this all
Just
the
go
time.
no audio.
Effects of pornography and masturbation. And here I suppose we need to be somewhat specific and operationally define what we're talking about. We're talking about porn and masturbation to the point of ejaculation, right? Because my understanding is that the ejaculation and orgasm associated with it causes an increase in prolactin, which blunts libido for some period of time. The duration of that will vary.
Crazy
person
how
to
much
person,
damn
as
pain's
well as
tied up in these
circumstance.
calves.
But
Dude.
basically all of this points to the
It's
fact
like
that
they're in
porn and
tune.
masturbation can really limit libido.
The muscles
in the
in
real
here
world.
and the tissue,
And
so it's
to
like
me, pornography and
you
the screen
can't
is not
get
the real world. Though screens exist in the real
the
world.
range
the
of
real world
motion.
doesn't exist in the
You
screen.
can't develop the
That's
muscle
an
as
accurate
well.
statement. And prolactin does
So it's like it's
have a
frozen partially,
significant acute
and it's
increase
it's hard to
after,
get out of there
ejaculation.
once it's
It
been in
does
there for
to
so
some
long.
degree after
Mhm.
orgasm as well, but prolactin acts on the pituitary to inhibit the release of the hormones LH and FSH.
People act like
Which
you just do
LH can
PT
increase
and
testosterone.
you're fine after a little
So this
PT
may be
exercise.
one of the cases
No,
where
this
the
shit's
dose makes
stuck,
the
bro.
poison, and if it is a very frequent habit,
Yeah.
certainly
It's hard to get out.
daily or more than once a day would be very detrimental from a hormonal component.
Like I've
not
heard
even
numerous
taking into
times when
account
people
the
ask to like
neurowiring.
when they go to get a
It's
massage,
true.
they ask their therapist
This
to be
is the
like,
problem. On the
hey,
internet or
can
even in the
you
doctor's
fix
office,
that?
you'll
And they'd be
see,
like, no, you gotta see a
especially
professional for that.
pornography Things
These
or-
are the calves
or hormones,
typically
you say frequent, but what's frequent? So
one of the
you're saying
harder
daily
things
or
to
multiple times a day
correct?
would be
Oh yeah.
potentially
Really?
detrimental
They're
to the
s-
hormone
they're
profile
so,
at essentially any age.
And that's just for
It's like the
I mean, people are, you spend time on them
pornography.
every day.
With porn
Reinforcing
it
bad
would
patterns
likely
so
be
much.
worse.
you see our cab over here on the.
Just the sort of.
So
Yeah.
you see the outer,
stimulus,
and then you
just
see the
the
inner on the
intense
right
visual
side.
stimulus.
See
Yeah.
all
Dopamine
those
sensitivity,
compacted muscles.
I think
Yeah.
Those muscles have to
using the
slide
analogy of
past one
dopamine
another.
wave pool, it
And
would
so
deepen
if
the
you
pool,
injure
will
something,
not increase
those
your
muscles
supply
they
of
get
dopamine.
partially adhered together to where they don't slide past each other anymore. You get that range of motion limiting.
Always credited.
You don't get it here, the body makes up for it in other places, which causes a domino effect of other issues. which
Yeah.
The
you have.
dopamine wave
I wonder if this will really help you
describes
aside
the
from
variation
Oh, I'm
of
sure
ups
it
and
will.
downs
On
in
this
your
side,
dopamine or your
Because now you're not
motivation.
going to be overactive
And,
on this
in
hamstring
the wave
once you
pool,
have
depending
dorsiflexion
on
here.
how
And that hamstring is what's
often
pulling
have
on
a
the ischial tube, which
deeper
is
trough.
pulling on the
So you do not
sacrum,
want
the
too high of a peak.
sacroiliac
In
joint,
addition,
all this
if your
in
peak
here.
is very, very high, for example, when you're using
I hope this is not something we
substances,
gotta keep for the next couple weeks, but maybe it is.
dopamine can go
Well,
so
as
high,
long as you
you
keep
lose
those
multiple
surfaces
water
sliding
from the wave
past
pool,
each
and
other,
when you crash from
it
not
won't
only
get
is
back
the
to
top
where
flow,
this is.
you have
That's why
less dopamine
like your
pulled
calves are
together.
so freaking
The
important
dopamine
in getting
receptor is
into those
extremely
deep
sensitive,
squats.
as
And
is the GABA
Ben
receptor,
Patrick's,
which is the
you
inhibitory
know,
receptor, whereas dopamine is
he's
typically a
right on
stimulant
it. The knees
related
over
to
toes.
granulated
Because
neuron.
when you go knees over toes,
The
you're in
depth of the pool
maximum
can change
dorsiflexion.
Right.
Yeah.
So, you wanna have
So
that
it
happy
keeps
medium
everything
where you're clearly
lengthened.
near the top,
So
but
I
you're
would
not so near the
definitely
top
add
that
like
the depth of the pool is gonna go down.
you know, some type of
So
even the
Brian
AG
took this,
split squats.
that
I actually
in
did them
context of
today.
this
Nice.
discussion about,
Those are perfect because they're
libido sex,
constantly
hormone masturbation.
challenging that.
If somebody
that
has a very
maximum
intense
flexion.
sexual
I know
experience,
that
not,
just
we're not necessarily talking about an
Us
intense-
chipping away the past couple weeks, I
We're talking
feel
about
better
just
doing
a lot of
those. It's
intense
easier for me to do them
so
well.
very,
Yeah.
a lot of intense imagery
Music
or
to
auditory
my soul.
input or both. That is going to lead to a situation where dopamine is
Yeah,
going to be
they-
depleted
it's-
afterwards.
They're hard to get rid of, and it's it's hard to break up, especially if you've got multiple injuries in this limb. It's gonna make it a tough go.
Pleasure and pain. There's going to be a longer and deeper period of lack of pleasure.
Instead of
following that.
sparsing it out into multiple sessions, I'm trying to get a lot done in
But if
one
that intense
session.
experience is coming from pornography and masturbation,
Which I appreciate.
or I suppose coming from
Even if it is painful.
It's better bang for your buck.
life-risking
It's what I would
pornography
want.
and deciding
Mhm.
I guess, you know.
it inevitably is going to lead to depressive episodes, low libido episodes that fall. Is that right?
Correct. In a similar physiologic way to withdrawal from stimulants like amphetamines.
And then, you know, a lot of guys wonder why aren't my calves growing?
Because
You know, I work them out.
Mhm.
chasing
Well, they're not
or
they're
intense
not sliding
experiences with
past
their partner
each other
as opposed to
enough.
through pornography and masturbation. Again, here we're talking
And
about
that's-
all ages, and I should always say, anytime we're talking about sex.
Yeah, I
or
wonder when,
porn,
I wonder when a lot of these issues really started.
I always, lay out on the
For me.
Hebrew Now podcast are that we're talking about consensual,
Sure, high school.
age appropriate, context.
Yeah, I mean,